All right. Hey, ladies and gentlemen, all across the globe, welcome to another time with My Health, Your Health with Kevin Vaughan. And man, before we get started, we got to talk to my wonderful guest today. What a great name he has, too. Mel J, Dr. Mel J, Colón. How you doing, Doc?
I am one happy man.
You got that right. We are two happy men today, ladies and gentlemen. Two happy men on the network today. Well, Doc, thank you so much for your wonderful time today. Appreciate you so much for being with us. Appreciate you very, very much for your time today as well. Hey, Doc, I wanted to open up real quickly because there's so much going on the planet as we were talking offline earlier. If you would just say a few words of encouragement and empowerment, somebody needs to hear your wonderful voice. Just letting them know, hey, keep going, keep going. Anything you'd like to say before we get started?
Well, I'll tell you what, I believe that Winston Churchill was the hero of the 20th century because he
Yeah.
said, never, never, never give up.
There
So,
you go.
everybody
Yeah.
listening, never
Yeah.
give up. Follow your
Yeah.
gut feeling,
Yeah.
praise God,
Yeah.
and work hard.
Yeah.
And
Yeah.
listen, for me, I think I'm so thankful that all of us are
Yeah.
alive now because they're
Yeah.
finding ways to to cure
Yeah.
disease, prevent disease, and to live a
Yeah.
lot longer.
Yeah. Yeah. I love it. I love it. Thank you so much, Doc, for that as well. Hey, guys, this is My Health, Your Health with Kevin Vaughan. This is part of our series on the MLT network where we bring in powerful people like Dr. Colón to talk about his expertise. I'm going to give you that in a minute. But, guys, real quickly before we get started, guys, I want to give you an important notice here. We are not medical doctors, and you correct me if I'm wrong, Doc. We are not medical doctors. I know I'm not for sure. And we are not here to treat, diagnose, cure, or any ailments or disease. Please consult, ladies and gentlemen, with your medical doctor or health practitioner for any personal health issues. And thank you so much for that. I had to put that in there for the network, Doc, as well. Thank you so much. Hey, ladies and gentlemen. Hey, Dr. Colón, ladies y'all do some research on him. Guys, he has his own podcast show as well. He's also been on television. He's been on radio, folks. He's been the guest on other podcasts as well with some of his colleagues around the country and around the globe. So we thank him for that as well. But real quickly, guys, I want to give you his background. Now, keep in mind, this is just a summary of his background, okay? You can Google Doc later on and check him out. But Dr. Colón, ladies and gentlemen, is a board-certified foot, ankle, and leg surgeon who specializes in chronic and recurring lower extremity conditions. He combines surgical and non-surgical methods to restore mobility and relieve pain. His goal is to provide long-term solutions that keep patients active and confident. So, guys, those listening live right now, I want you to pay attention. Now, Doc, I was thinking about this right now. Now, with all due respect to people who don't have their limbs, we're talking about mostly everybody on the planet is on their feet right now, pretty much, or going to be on their feet at one time today. So we know everybody has a commonality of that area. So we thank God for that in that area. So we're going to talk a little bit about this for sure today with Dr. Colón. Doc, I want to release this mic to you because you are the expert. I also want you to just share anything, any of the top areas that you have seen or do see that we need to hear about and also contact you about as well. Now, Doc, we have your phone number up there, and you mentioned to me earlier that this is Monday through Friday, or actually 7 days a week is the phone number, I believe you said, from 8 a.m., 9 a.m. to 8 p.m. You can call that number, guys, for an appointment. Right there, you guys can listen to this first, but then you can also take a picture of this or write this down as Dr. Colón is talking. But Doc, I want to release this time to you and let us know what you want us to know today concerning your expertise. Thank you so much, sir.
Okay, well, I don't know if you, Kevin, and your listeners remember the comedian Rodney Dangerfield. He gets
Absolutely.
no
No.
respect. He
Yeah,
gets no
exactly.
respect. So I
Exactly.
wrote an article for a publication, and the
Yeah.
article was "The foot is the Rodney Dangerfield
Oh,
of the
yeah.
human body. It
Yeah.
gets no respect. It's the number
Exactly.
one most neglected body, most
Yeah.
ignored, most misunderstood, most
Wow.
misdiagnosed part of
Wow.
human body, and most treated. So
Wow.
what I specialize in
Yeah.
is I specialize in really difficult, chronic, unresolved,
Wow.
painful foot, ankle, lower leg problems.
Yes, sir.
that other doctors, although they're excellent,
Yeah.
a lot of times they can't find a solution.
Yeah.
So when people come to me, 88% of my patients come from the Atlanta area, but
Yeah.
12% come from the other 49 states,
Yeah.
and about two people a year fly in from other countries. But
Yeah.
so I take care, and also I'm very gentle,
Yeah.
extremely gentle, and I
Yeah.
usually get people well in one visit. I know that sounds outlandish, but that's what I came up with. So to answer your question, Kevin,
Yeah.
and by the way, thank you so much for having me on.
Thank
I
you.
have a lot of respect for you, Kevin, for what you're doing. You're doing something very important. I believe you're living a life of significance. So thank you for what you're doing for the world and for this country.
Thank you, Doc.
So basically, the foot is a very unique part of the body. There's 26 bones, 107 ligaments, 19 muscles, 33 joints, and
Wow.
250,000 sweat glands in each foot. The foot is
Wow.
called upon to carry the body. It basically will walk about 100,000 miles in a lifetime.
Wow.
And so there's different myths or fallacies about the foot. People
Yeah.
think there's nothing that can be done about the foot problem, but that's not true. I've never seen a foot problem we couldn't help.
Wow.
And so also people think that they just have to suffer with it. So it
Right.
affects people when they can't work,
Right.
or they can't work full time, or they can't dance, they can't do
Yeah.
sports, they
Right.
can't exercise. So, it's very unique part of the body because think about it. If you
Yeah.
have pain in your face or on
Right.
your elbow,
Right.
you don't walk on your face or your elbow. So if the doctor gets rid of the problem, but the problem with the foot is that they have to bear weight on
Right.
that part of the body. So it's a very unique part of the body.
Wow.
So what I do is very gentle. We get to the bottom of it. I treat every patient like family or
Yes.
like they were king or queen of a country. We
Yeah.
spend more time with them. And as far as your question, some of the common things that we do on the foot
Yeah.
is peripheral neuropathy, nerve pain. So
Mhm.
nerve pain, like burning, numbness, tingling, and sharp
Yeah. Right.
electric shock kind of pains.
Yeah.
Do you need to say something, Kevin?
No, no, you're fine.
Okay.
You're great.
Okay,
Yeah.
fine. So what we use, there's five things that cause nerve pain usually, and
Yes,
that's
sir.
diabetes, hypothyroidism, underactive thyroid,
Yes, sir.
pernicious anemia, post-chemotherapy, peripheral neuropathy, and alcoholism. Those are the big five for
Gotcha.
that. So we use a therapeutic sympathetic nerve block, an
Wow.
injection, but I do it in either painless or almost painless
Mm-hmm.
because
Mm-hmm.
they say women do better with pain than men, but what I've come up with is techniques of treating people without pain.
Yes,
So
sir.
that's a big one. We also use the nerve blocks for arthritis. We use it for failed foot, ankle, and lower leg surgeries where they just feel like, well, they just have to live with this for the rest
Yeah.
of their life, but they don't. We
Right.
see a lot of people with fungal toenails, it's really thick,
Yeah.
thick,
Yeah.
ugly toenails.
Yeah.
Uh, I have two ways of treating it. The second way, which takes more time than we have, but is where 95 to 98% of the time the nails will grow back normal.
Yes,
We
sir.
also have ingrown toenails. We see a lot of
Right.
people with ingrown toenails. And
Yeah.
what I did is I took the procedure that all the people in my profession use and I modified it. That's
Mm-hmm.
why they say practicing as a
Yeah.
physician is a
Yeah.
science, but it's
Yeah.
also an art. It's creative and innovative. Okay.
Yes.
So I
Yes, sir.
took that procedure, I modified it, and for me, 100% of people come to me with an ingrown toenail. 100% of the time, it'll never, ever, ever come back. And
Wow.
I do it in a very gentle way.
Yes, sir.
Uh, so we treat flat feet. We treat so many different kinds of problems you can imagine.
Wow, that's wonderful. Hey, ladies and gentlemen, if you're just joining us, I'm talking to board certified Dr. Colón, ladies and gentlemen. We're talking about your foot, my ankle, your ankle, and leg areas as well, folks, getting some wonderful areas. Doc, one of the things that our audience has been talking about is the tingling of the feet and the feet. Can you talk a little bit about that? And folks, you got to call them for this, okay? You got to call and get more information, of course, and set up an appointment. But Doc, What's going on with our feet today in the area of tingling or neuropathy, I think it's called as well. Can you
Yeah,
talk?
peripheral neuropathy. Some people
Yeah,
call it nerve pain, but
yeah,
again, we use the nerve blocks for that, and it's
yeah,
dramatic. And it's in the
yeah,
medical literature, but very few doctors actually
yeah,
use that type of treatment.
yeah,
So it's something I'm very proud of.
yeah,
And so when people come to me and they think they have to live with that burning, numbness,
yeah,
tingling,
yeah.
or
Right.
lightning kind of sharp pain,
Yeah,
they don't
yeah.
have to live with it. They don't.
Right, right. That's wonderful, Doc. Doc, a lot of our audience do a lot of walking and running as well, and participating, with their children or grandchildren as well. Can you talk a little bit about that for those who say, hey, I want to start running again? Is there any background in that area as far as your patients is coming with that
Yeah,
to
I
run?
would say about 70 to 80% of people need orthotics to go into shoes because they have a really flat feet or
Yeah,
too high an arch. Okay.
gotcha.
So we take white plaster cast impressions of their feet, holding
Gotcha.
their foot in the position they were intended to walk in when they were born. Then we
Right.
shake it off the foot. It kind of looks like a white slipper. And
Yeah,
then we
yeah.
let it dry for 24 hours. I
Yes.
mail it off to a laboratory in Tennessee and they
Yeah.
make these orthotics. They're custom made orthotics, just like these glasses help me
Yeah.
for distance and for reading. It's
Right.
prescription. Same
Yeah.
thing, orthotics are prescription. So you don't want to buy something in a pharmacy because it's not exactly the proper for your foot.
Right. I got it. That's wonderful. Well, Doc, we want to do a commercial break real quickly. Tell folks how to get in touch with you if you don't mind. I love it. Yes, sir. Yes, sir. So we want to talk now, Doc. I want to give that number out, guys. That's I'm sorry, 678-547-0000, guys. You can call Doc today, right,
No,
Doc? They can
four
call you.
zeros. Kevin, four
Oh,
zeros.
40. There you go. Thank you. Let me give that again because it's right there. I need to see the reader, right? 678-547-0000, guys. Okay. Is
Right.
there right there. You guys can see that as well. So, guys, I want you to set up your appointment there with Doc if you have some areas. We're talking to Doc. He's board certified for foot, ankle, and leg areas for guys. He can help you with that as well. That's powerful. Doc, in our town, specifically in the metro Atlanta area, we got a lot of young people that are into sports. And some of your clients, young people as well?
Yes. Actually, believe it or not, most people think we see a lot of older people, and we see
Right.
all ages, of course, all ages.
Yeah, right.
But I would say my particular practice, we see a lot of kids
Yeah,
and people in their teens, 20s, 30s, 40s, 50s, and
yeah,
early 60s. So we
yeah,
tend to see younger people. That's
yeah.
just who comes to me. And one more thing I want to tell you, Kevin,
Yes, sir.
even though I'm a board certified foot and leg surgeon,
Yes.
actually, my part of my specialty is keeping people from needing surgery. So
There
there's
you go.
conservative, non-surgical treatments
Yeah,
to keep people from having the
yeah.
surgery they think they need.
Yeah, there you go, Doc. That's good. Now, Doc, let's talk about that because I'm big on prevention as well. Being in the quality business for a while, prevention is 99% of the goal, right? For sure. So, Doc, what should we be doing, Doc? Based on your history of your clients and what you do, what should we be doing right now today, or you suggest that we should be doing differently, sir, today?
I actually even go into other things like what they should eat and
Yeah,
exercise and
yeah,
what they should drink water
right,
when they wake up and all those
right,
kinds of things because
yeah,
I'm actually look a lot younger than I am. And that's because I've been studying anti-aging, life extension,
yeah.
longevity. So I'm 77 years old. Okay.
No,
And,
really, Doc? You look like you're in
and
your 50s, man.
people think I look 15, 20,
Yeah,
25
yeah,
years younger.
yeah.
And so we give people advice. We spend a little bit more time with them. So I
Yes.
think it's very important for people not to sit too much because
Yeah.
sitting is like they say, sitting too much is like smoking cigarettes. So,
Wow. Really.
or being overweight, really overweight. So it's very important to eat right. And
Yeah.
so, for example, gout, people have gout with
Yeah.
arthritis.
Yeah.
It's because it's too much uric acid. It tends
Right.
to accumulate in the big toe joint, like here, the
Yeah.
bunion joint. And
Yeah.
what we do is we use those nerve blocks, which
Yeah.
flush out those urate crystals in that
Wow.
joint. And also people should know that having a high uric acid or gout can also
Yeah.
cause heart disease. And a
Yeah.
lot of people don't know that. So we
Right.
tend to go into other areas to
Yeah.
give people a complete experience in
Yeah.
coming to us.
Oh, I love it, Doc. Hey, ladies and gentlemen, if you're just joining us around the globe here, this is My Health, Your Health with my wonderful guest today, board certified Legio and Dr. Colón. He's foot certified in foot, ankle, and leg surgery. We're talking to him today about some of the top areas that we all consider may have, if you will, and also the prevention side. Doc, I wanted to ask you about foot massages. Does that help us at all? I know a lot of people go get their feet massaged every now and then. What do you think about that?
Yeah, could you send someone over? I need a foot massage right now. No, I'm just kidding.
Yeah, yeah,
No, actually, foot massage is good. It's
yeah,
good. It's
yeah,
definitely
yeah.
good. It helps
Right,
relieve some pain.
right,
The only problem with a foot massage is it's not a total answer.
gotcha,
It's a temporary thing, but it
right,
still is. It's a healthy,
yeah.
good thing to do.
Very good. I know a lot of my clients and also a lot of my constituents around the country, specifically, Doc, they do a lot. I mean, they're busy all the time. They need to rest their feet. Can you talk about soaking feet, and later on in the day? Is it good to soak your feet and what? I don't know what, but can you talk a little bit about that? At the end of the day, can people put their feet in some water or something to help them out?
Yeah, no, that is definitely good as well.
Yeah,
It's kind of a cousin to hydrotherapy, where you
yeah,
get in one of those whirlpool hydrotherapy things.
yeah,
But
yeah,
it's good sometimes to use salt or
yeah,
or Epsom salts. It's good as
yeah.
well.
Okay.
And no, that's good. That's good. But again,
Yeah,
that's going to be a temporary. It's
right.
not going to be a real fix. What I
Absolutely.
like to do, my whole thing, my
Yeah.
MO is I get people well fast.
There you
I don't
go.
like the idea of when you
Right.
go to a physician that
Yeah.
you're in and out, you don't know what the doctor just said, it's
Right.
not clear.
Yeah.
And so what we do is we explain everything
Yeah.
and then we get people well, usually
Yeah.
in one visit. Okay.
Right. Right.
So I just,
Right.
that's just my style.
Yeah.
Everyone has
Exactly.
a different style.
Yeah, I love it, Doc. Yeah, we want you to keep your style, sir, because there's only one of you on the planet. That's for sure. Hey, Doc, I was going to ask you about consultation. Do people call? They can call the number, but do they get an initial consultation? Also, I want you to talk to us about your payment method as well, how that all works, if you don't mind, insurance and so forth.
Okay. Yeah. I'm going to explain all that. Thank you for that question.
Yes, sir.
So every doctor practices differently.
Right.
With me, basically, we don't take insurance. So I just want everyone listening to
Right.
know we don't
Yeah.
take insurance. Although I mentioned Rodney Dangerfield before,
Yeah.
and the insurance companies a lot of times don't pay well for foot problems.
Right.
Sometimes they don't pay at all. So
Right.
we're a cash credit card clinic, and
Gotcha.
so if someone comes in with insurance,
Yep.
and because they're coming from your podcast, Kevin,
Yes, sir.
we'd be happy to uh, reduce the fee to accommodate the fact that they have insurance and they had to drive to come see us.
Right.
So we will very often, reduce the fee potentially even in half or even
Yeah.
more than that. So
Yeah.
we're here to help people.
Yeah.
Oh, you
On.
will.
Yeah. Yeah, that's wonderful. Hey, ladies and gentlemen, the Doc's number right there, guys. You can call him today, Monday through Friday, guys, starting at, I think it was 9 o'clock. Yep, 9 o'clock to 8 p.m. That number, 678-547-0000, guys. You can do that today, okay? But guess what, Doc? I also want my network to share this out on the planet for everybody that they know. So, guys, I want you to push this video out on other platforms because I tell you, man, there's going to be somebody who's going to need Doc's help today or this week sometime or in the future. So we thank you so much for that. Yes, sir, Doc.
But let me say this for all the people listening,
Yeah,
if you have, uh, let's say 20 to 40% of all the people in your contact
yeah,
list,
yeah,
20 to 40% of them have an unresolved foot, ankle, lower leg problem. We're in
right.
Swanee, we're in Swanee, Georgia, which is a suburb of Atlanta, northern
Yeah,
suburb of Atlanta.
yes, sir.
And so really and truly, if you send this video out,
Yep.
or
Yeah,
if you get to Kevin how I could send you another video from another podcast, we
yeah,
could do that.
yeah, absolutely, Doc. Yeah, we're here to help get the word out. Like you said, our goal is to help people. But one thing I'm big on, Doc, first of all, is good planning, but also good information, right? But also people understanding the why. I'm going to be doing some series, Doc, on why we're doing this. There's a reason for all of this, folks. The goal is to get you to your best health yet. That's really the bottom line. But you got to have great people. You got to have certified people. You got to have knowledgeable people like Dr. Colón, ladies and gentlemen, that knows what he's talking about as we talk about this foot, ankle, and leg areas, guys. So, Doc, this is powerful. And because I know a lot of people, Doc, I want you to talk to our seniors out there as well. Can you talk to our seniors that are in their 60s and above that also have some little issues with their feet and ankles and even their leg? Can you talk to some of them talk about getting their leg cut off and all this kind of stuff, because that's what was recommended to them. Can you talk to our seniors a little bit about some of your expertise, please?
Well, a lot of what we do is prevention of uh, amputations, okay?
Yeah.
Because a lot of times when people have diabetes and it's
Yeah.
neglected, and they
Yeah.
may have, some gangrene and
Right.
may not be able to see it or feel it
Yeah. Yeah.
because, because
Right.
diabetics have retinopathies that have problems with their eyes,
Okay.
and then they have peripheral neuropathy, so they don't feel things as well, a lot of
Yeah.
numbness. So
Yeah.
it's very important that another family member or
Yeah.
somebody else that you're close to could examine your feet, maybe at least
Yeah.
once a
Right.
month. And dentists are very good with marketing. So they
Yeah.
say, you need to see your dentist twice a year and
Yeah.
get your cleaning. Well,
Right.
people should at least see somebody in my field at least
Yeah.
once a year or once every other year, okay?
Yeah.
Because
Right.
you don't want to end up with a problem.
Right.
And if you have a problem, your foot is the foundation to your body. All your
Right.
weight goes on your feet. I
Right.
compare it to a house. When you
Right.
build a house or a shopping center, you put the foundation in the ground first.
Yep.
If the foundation isn't right, then everything
Yeah.
above it will not be right. Same
Right.
thing with a car. When you drive a car with your wheels out of alignment, your tires are out.
Right.
So it's very important to see if you need orthotics, because
Yeah.
orthotics prevent corns, calluses, bunions, heel spurs, ankle sprains, and
Gotcha.
fatigue and tiredness with your feet, legs, and back. Even it can make sciatica worse if you have
Yeah.
really flat feet.
Amen. I love it, Doc. Doc, while you was talking, I was thinking about our audience of women too, as well. We got a lot of women that listen to the network as well. And, they got to keep their feet right. You know that for sure. So can you talk to our women? Any preventive or anything you like to share with the women out there that always like to have their shoes, wonderful shoes on, and, just some of them go bare feet, during the right time of the year. They like to go bare feet. But can you talk to our women about prevention
Yeah,
of,
I know women really like the high heels, and men like to look at them in the high heels. But high heels can be very dangerous. So
yeah,
you don't want to. If you're going to wear high heels, try not to wear them all the time. Okay,
right.
try to cut back on it, and
Yeah.
it'll serve you well, because high heels will cause all
Yeah.
kinds of problems with your feet and your
Yeah.
back.
Yeah, exactly. Yeah, just the
And also, I
physical.
wanted to say, we
Yeah,
don't. I'm a physician of the foot,
yeah,
ankle, and lower leg. So
right.
we don't treat the knee. We treat from
Gotcha.
below the knee down. So I wanted to make that clear too.
Yeah, thank you so much, Dr. Colón. Yeah, that's powerful, ladies and gentlemen. Hey, folks, we talked to Dr. Colón, once again, board certified ankle, foot, and leg surgery, folks, from the knee down. I love it. You just heard it from him as well. Wow, that's powerful. So, ladies, we want you to take care of yourself even better. We're talking about prevention more than anything else. Guys, same for you as well. I got even our young people who are very active. We got a lot of young people who are just gifted. Doc, they love the sports. They love to do different things with their bodies, which is great, and to enjoy their wonderful lives, but sports specifically. And it could be gymnastics, right? All the above. I'm sure you deal with gymnastics too as well, Doc. You have some gymnasts that come to you every now and then as well?
Oh, absolutely, absolutely. I
Yeah,
love it.
yeah,
Yes, yes. Yeah, a lot of them. Well, that's actually a very dangerous sport, because
yeah,
sometimes they throw people up in the air. You got to make sure they
yeah,
catch when you
yeah,
come down.
exactly.
So a lot of
Yeah.
them get concussions, and a lot of also they get a lot of ankle sprains.
Yeah, that's powerful, Doc. Hey, guys, this is My Health and Your Health with Dr. Colón today, folks. We're talking about this wonderful part of our body, foot, ankle, and lower leg, if you will, area, folks. We're just excited about Doc sharing his expertise. Doc, I want to ask you, if you don't mind, go back in time here. What brought you to, is this a history of your family being doctors? How do you get into this profession, sir?
Well, I'll tell you what. I have an older brother,
Yeah,
and he decided to be a podiatrist, foot and leg surgeon,
yeah,
and he's older and he has bigger feet, so I
Yeah.
followed in his footsteps.
Oh,
But
I love it.
but I'm just trying to be funny. I did follow
Yeah.
in his footsteps, but my
Right.
feet are bigger than his.
Yeah, I love
So,
it. That's great.
yeah.
Now, see, that's a Rodney Dangerfield quote there, almost. Yeah, Rodney will get you fired up, man, on that one for sure. That's good. That's good. In fact, Doc, you may want to take that on the road there. Your comedic background there, a little bit. I love it. Make people laugh and heal them at the same time. That's wonderful. That's powerful.
Absolutely.
Hey, man, I love it. Hey, guys, we're here with Dr. Colón today talking about your wonderful body, specifically your ankle and your feet and your lower leg area, folks. He is the expert in this area. He loves what he does. You can hear it in his voice. He's also certified to help bring in that expertise and that little additional way he does things, okay? I'm sure he has colleagues around the globe that do things differently in those areas, but there's only one Dr. Colón, I can tell you that much. There's only one of him, and he brings his unique style to help us stay healthy with our lower leg areas, folks. That's powerful. Well, Doc, this is great. This is so great. Doctor, is there anything we missed that you want to share with the audience? Anything you want to share?
No, just
Yeah.
don't feel like you have to just live with and live
Right.
and suffer with foot,
Yeah.
ankle, lower
Right.
leg problems, thinking
Yeah.
there's no way, or
Yeah.
a physician has told you there's nothing
Yeah.
more I could do. I'm
Right.
telling you, there's a
Yeah.
lot that can be done.
Right.
That's my whole thing. Is I
Yeah.
get people well where
Yeah.
very often they think nothing can be done.
I love it. Now, Doc, let me ask you a question then. So, with that said, Doc, should I get, I'm going to use me, guys, but you guys think about this too as well. If I get one opinion from my doctor or whatever, should I get two or three others in that area? Especially when
Uh,
you're cutting
it
stuff.
depends how confident you are with the
Yeah.
physician.
Right.
But it's no problem with getting
Yeah.
another opinion.
Right. Yeah. Just get information. You don't have to necessarily go away from that. I'm just saying get two or three other opinions, folks, and make that assessment yourself. And then go back to your doctor and do what you got to do. It's your decision, of course, to do whatever you got to do. But Doc, I've heard that even family members had to get their lower knee, below the knee. They had to get that cut off for whatever reason. And I'm saying, man, could there have been some prevention before they lost their leg? And I don't know, but you're saying there's potential there for that to save the leg. Is that correct? In some cases.
It's very important not to neglect your feet. This is
Yeah.
it's a worldwide problem.
Yeah.
Truly
Right.
worldwide. As a matter of fact,
Yeah.
a place like, let's say, Barbados in the Caribbean, so
Yeah.
many people are getting amputations unnecessarily
Oh,
because diabetes can be reversed. A lot of people don't know that.
wow.
Diabetes, type 2 diabetes,
Wow.
which is the
Wow.
most common one, can be
Wow.
reversed.
Y'all hear that? You guys hear that, Doc? Say that again, because folks need to hear that.
Diabetes can be reversed.
Wow.
And so, I mean, for the last 40 years, or maybe
Yeah.
50 years, I've been
Yeah.
studying anti-aging, life extension, longevity. I eat
Yeah.
an organic Mediterranean diet. I take a
Yeah.
lot of supplements every day.
Yeah.
I exercise a lot. I
Yeah.
meditate twice a day. I
Yeah.
pray every day.
Yeah.
And I deeply care about what I do.
Absolutely. Yeah, I can hear it in your voice, Doc. No doubt about that. And you've been highly recommended from my colleagues and people that I trust as well. So that's powerful when you think about that as well. So, guys, hey, we're talking to Dr. Colón, ladies and gentlemen, Dr. Colón, and his number to contact him today, Monday through Friday. And I believe that's 9 o'clock. Yep, 9 a.m. to 8 p.m. Monday through Friday. Actually, it's 7 days a week. I think you mentioned earlier. Is that correct? Pretty much.
7 days a week.
Yep, 7 days a week. That number 678, guys, 678-547-0000. You guys put that in your phone today. Dr. Colón, you can see his name right here. Guys, put it in your phone and contact him this week. Even if you got family members that you think need to talk to Doc, you can check with them, of course, first, and then contact them as well. Doc, I want to give you some final thoughts. Any takeaways, anything you want to share with us as final thoughts for today? Anything you want to share that we need to know about?
Well, the only other thought I would have, if some of you I know are in the Atlanta area,
Yeah.
I just really enjoy teaching. So
Yeah.
I'm available to come to a church, a school, a business, an
Oh, great.
organization.
Oh,
I
good.
give a talk, and then
Yeah.
I open it up for questions. And if
Very
people
good.
want me to examine their feet, I
Yeah.
will do that, and I'll give them a good idea of what their
Wow.
problem is, what caused it, and the different ways we
Yeah.
could treat it. And I don't charge for that. I don't charge for that.
Oh, that's
So,
great, Doc.
um, so yeah, that's a thought that I could do that, or I could be
Yeah.
on other
Yeah.
podcasts that you know.
Absolutely. Well, Doc, I want you to be a regular over here if you approve it. So I want you to come back as much as possible because we have a tremendous following around the globe and we want to get the information out. We also got ties to our senior centers in the metro Atlanta area. So we got to get you down in one of those and get that as well. We got ties to churches. So those who are leaders in the church, I want you guys to consider having Doc come out and talk to your congregation. As well as a speaker and then demonstrations or whatever he has, guys. So you guys do that. So I want everybody also too, Doc, those who have a podcast, if you, my colleagues, you got a podcast, invite Doc to come on your networks as well. Okay. So you guys in television, you got your radio, you got your podcast, you got your TV, digital, all the above. Give Doc a call. Recommend it, sir.
And also, besides podcasts, I could do internet radio, regular radio, and regular TV as well.
Absolutely, guys. Absolutely. So you guys give him a call, set that appointment up. And between now and the end of the year, you guys should be able to book him on your show so we can get this information out. Ladies and gentlemen, he's one of the best in the field, and folks need to at least know about him and also get the benefit of being one of his patients, if you will, or clients as well. So we're excited about that. Doc, man, this is incredible. Thank you so much for your time today. We are good. You ready to anything else, Doc, before we let you go today?
No, Kevin, it's a delight and a pleasure to be on your podcast, Kevin. I have a lot of respect for you. So thank you so much for having me on.
Oh, thank you so much. And the respect and the double portion goes back to you, Doc. Thank you so much because we serve a mighty God and we thank him for your life. In fact, I always tell my friends, I'm so glad you were born, Doc, and for such a time as this. So thank you so much.
That's right.
For that.
Praise God. Thank you.
Amen. Hey, ladies and gentlemen, hold on, Doc. Hey, for those who've been with us or not, or just joining us, we've been talking to Dr. Colón, ladies and gentlemen. He's board certified. Got to give him his credit here for foot, ankle, and leg surgery. He's one of the best in the business, folks. And that number, once again, you guys see it right here. That's 678-547-0000, guys. Call him this week. Set up an appointment, guys. Get your discovery call, whatever you have to do there. But guys, take care of your body, okay? But Doc, one thing I really encourage my people to think about is think. Use your wonderful mind, your brain, folks. Think about what you need to do and get it done, okay? We have so much information today, ladies and gentlemen. There's no excuse for not taking care of your feet and your ankles and your lower leg area. But you got to do your research, right? Doc mentioned to you about you got to work. You got to find out. You got to pick up the phone and make the call, right? We're not going to just know that you want this, right? Because it's all about your health. And that's what this is all about. My health, your health. With Kevin Vaughan, our goal is to get information out. I am not a doctor, so I'll get that straight. I am not a doctor in the medical field or in that area. I'm a technology guy. So we want to make sure we bring in people, board certified people like Dr. Colón to talk about these powerful areas that he is certified in. Doc, once again, give love to your family, Doc, and thank you so much for your time. Hold on, Doc, we're getting ready to close it out, but thank you so much again, Doc, for your time.
Thank you.
Amen. Hey, guys, as my mentor would say, remember to always outlove, outserve, and outforgive each other. And remember, as Doc opened up earlier, never give up, folks. You can do it. You can do it. And the Doc can help you, folks. We can help you. Doc can help you. And if you guys got any problems getting with Doc, let me know. I'll be glad to send you that phone number over to you as well. So wherever you see this app, if you got a problem getting in touch with him, let me know. I'll forward your request to him as well. Doc, again, have a great day, sir. And we'll talk to you soon.
Thank you.
All right. Thank you so much, everybody. Hey, guys, don't forget to share this out on all your social media platforms. And I'm thanking you in advance. And we appreciate you. Have a wonderful day. Be productive, folks, and be intentional this week and this day. Take care. We'll see you next time on My Health, Your Health with Kevin Vaughan. My special guest today, Dr. Mel J. Colón. Wow, what a great name, Doc. I love it.
Thank you.
All right. Take care, everybody. We'll see you next time. Bye-bye.